I'm a medicine resident at Texas Tech University Health Sciences Center Permian Basin Hospital, and today I'll be presenting a very interesting case about a rare presentation of primary Sjögren's neuropathy. So our patient is a 32-year-old female who was recently diagnosed with Hashimoto's thyroiditis, who presented to the emergency department due to a new onset ascending numbness, tingling, and weakness that started in her feet and ascended all the way up to her upper extremities and neck. Patient denied any history of tick bites, any history of diarrhea or trauma. Basic workup was unremarkable, including negative HIV, RPR, B12 levels, and heavy metal testing, in addition to hepatitis B. Given the suspicion of GPS, Guillain-Barré syndrome, neurology team was consulted. CT brain and MRI brain and spine were unremarkable. Lumbar puncture was performed and it was insignificant. However, due to a strong suspicion of Guillain-Barré syndrome, patient was started on IVIG with no improvement. On further history taking, patient mentioned that she had been complaining of dryness in her mouth and eyes. So rheumatology team was consulted and they sent the antibodies, which were positive for ANA and SSA antibodies. Patient was started on hydroxychloroquine in addition to a steroid taper with improvement of her symptoms, then discharged with the further follow-up rheumatology clinic for working up her neuropathy with nerve conduction study and electromyography. Primary Sjögren syndrome is an autoimmune disease that primarily affects exocrine glands and salivary glands. The prevalence of Sjögren syndrome in adults population ranges from 0.01% to 0.1%, and it's predominantly happening in females compared to males. Common clinical symptoms include dryness in mouth, eyes, and other areas in the bodies with reduced secretions of the lacrimal glands, salivary glands. Neurological manifestations of primary Sjögren syndrome can be categorized into peripheral neuropathies or central nervous system involvement. CNS involvement in primary Sjögren syndrome can resemble conditions such as multiple sclerosis, encephalitis, cerebellar syndrome, and movement disorders. Studies have shown that CNS involvement is present in a significant percentage of patients even before the diagnosis of primary Sjögren syndrome. The incidence of peripheral neuropathy associated with Sjögren syndrome tend to increase with age. However, there is a risk of underestimating paralysis of neurological complications of Sjögren syndrome. In conclusion, primary Sjögren syndrome has a significantly higher incidence of females compared to males, with a ratio of approximately 9:1. Around 30-40% of patients with primary Sjögren syndrome exhibit systemic manifestations, which often serve as initial indicators for the diagnosis. Neurological involvement in primary Sjögren syndrome primarily affects the peripheral nervous system, with distal axonal sensory and sensory motor polyneuropathies being the most common types.